it's traumatizing. And thinking about, I can still picture my less than 1 year old daughter in hives from the moldy house. It's when you see your children like that, it's scary.
My name is Michael Rubino. I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Hello, thank you for watching another amazing episode of Never Been Sicker. Today's special guest is Dr. Eric Potter. Dr. Eric Potter, thank you so much for taking the time out of your busy day to be here with us.
Thank you for having me on. I'm looking forward to it.
So what's really interesting about you is not only do you deal with mold and Lyme disease in your practice, but you've actually had some run-ins with mold personally, right?
Yes. Yeah, it was odd in that I was treating a lot of patients in my clinic with mold toxicity, and then I realized that my wife was also suffering. We had already treated her for Lyme disease and was better, but there is, as you probably know, there's still some lingering symptoms. And then tested our house and found out we were renting a house at that time, found out it had mold, started going down that rabbit hole until we realized, oh, yeah, mold is playing a part in her health, realizing it was playing a part. Probably my daughter, even before that, in that she was having a lot of symptoms, and realized, oh, yeah, we've got the bad genetics in her family. So I've walked in those shoes, which kind of makes me more excited about helping others get out of mold because I know what it's like to live in that.
So you've seen firsthand, genetics and epigenetics play a role into this. You don't have those genetics, is that correct?
I have that low MSH, the was it 1.5, but I sneeze at mold. When we were cleaning up the house we were in, it would make me sneeze my head off. But as far as I know, I never had any significant symptoms from it. Nothing compared to what the rest of my family did.
Now, when you compared yourself to the rest of your family, obviously you're in a different dynamic because you've seen this firsthand. Was it hard to relate to your family at all when you were going through that? A lot of husbands, particularly if their wife's sick, or wives, if their husband's sick, they have difficulty really understanding what they're going through.
Yeah, it helped having seen other patients, so I knew that my wife wasn't obviously just making things up. Now, I know you talk to other providers, it's also difficult being the provider for your own family or yourself when doctors take care of themselves. Some of the worst patients are when it's you yourself. But it was me having to consciously step back and like, okay, step out of being the doctor husband, thinking about being the patient husband and realizing, oh, yeah, these are real symptoms. These are not things that are just, oh, you're nervous. Oh, you had a bad day. You've had a bad night's sleep. No, you really feel miserable. So I had to think from here to get past that part where the heart was like, oh, I felt bad for my wife. I felt bad for, I had a less than 1 year old at the time who was breaking out in hives, who, until we figured out it was mold, had no reason why she was laying in her crib at night with hives over her. So I knew it was real, again, from other patients, but it was a surreal experience seeing that in your own family.
Now, because you've had this experience before, I want to try to any value you can add to this equation. There are a lot of people that listen to this that might be going through similar challenges of what your family went through. And maybe their spouse or their parents or whatever it may be, they're not understanding what they're going through. They're struggling and they're not really being believed that their house might be the issue. What sort of advice might you have for someone going through those struggles so that they might be able to help communicate better what they're going through and really getting that buy-in from the rest of their family?
Yeah, and so with seeing patients with mold, especially those who are in the more moderate to severe, one of the things I say, it kind of dehumanizes. It takes away a lot of the normal ability to function, and that includes into relating or communicating. So you take someone, a spouse, who's super sick, barely can get out of bed in the morning, and is having trouble with word finding or brain fog, and they're trying to communicate difficult emotions that they can't really understand themselves to someone who completely doesn't have that experience. So when I'm sitting there and I see a lot of patients, the spouses, is usually between the spouses, like, well, I'm in that house. I'm not sick. I try to talk them through the objective things, the things that are absolutely clear. We all have different genetics, is number one. I tell them, we all know those people who smoke for 50 years, who then can go run down and run a 5K when they're 60 years old with a cigar in their mouth and never be bothered by tobacco smoke. Then we know those people who smoked a half a pack a day for 5 years and are on oxygen with lung cancer. We can all handle toxins differently. So, yeah, you're feeling great, but your wife or your husband may be miserable because they can't handle those toxins. So let's just start with the fact genetics are different. Um, from there, and then being able to show them, okay, here's some tests. We've run these tests. We've looked for thyroid. We looked for adrenal. We've looked for other things and haven't found them. But then we look at these tests that show, yes, your body's reacting to mold. Yes, mold toxins are present in the body. And yeah, your house or a past, it's not always the house they live in. It could be where they moved out of 2 years ago. That location had high levels of the molds that are making the toxins we're finding in the body. So this is very plausible that your spouse has these things. And then I can say, listen, I've taken care of over 1,000 patients at this point. I've been through this myself. I understand what it's like being the well spouse who doesn't have those symptoms. I can tell you, I see people get better when you get out of the mold. You can't still live in the mold and expect to get 100% better. You deal with those inflammatory responses, you get the toxin levels lower in the body, they get better. So this is not just all in your spouse's head. This is not all something else. We've looked for the other things. We've got explanations. And then I say, listen, it's going to take time. This doesn't get better. Rarely you have those patients who move out of a job, move out of a house and get better 2 months later. Great. I love those patients. Most people take 6 months, a year to see that significant improvement. Give me time. And I think I can show you that your spouse is going to feel normal again. So it is trying to walk them through there and say, get it. I understand. I'm expecting you to spend, potentially a few thousand, sometimes more on your side of the business, working with the environmental remediation side. They may spend twice as much or 3 times as much trying to remediate a flooded house, a water damaged house. But that health, getting you back your life again, is worth it. But trying to be understanding with those spouses, because I get it. The symptoms that people come to us with sound like they're completely crazy, and people have been told that. Oh, this is on your head. Oh, you need a Prozac or Paxil or whatever it is. These are real symptoms, though, and people really get better when you deal with the root cause of the issue.
Yeah, thank you so much for that, Dr. Potter. If you happen to be listening to this episode and you are struggling to communicate with your family, or your family really doesn't understand the breadth of what you're going through and the challenges you're going through with this illness, please share this episode with them, so they can, hear from Dr. Potter and his experience in dealing with this, not only, professionally, but personally as well. I think that it's important that we come together as a community to really understand one another and what we're going through and help each other out of this, because that's really what it takes a village of us. You mentioned, obviously the environmental side. It's kind of a teamwork approach, right? We want to limit the exposure that is creating the problem in the first place, and then obviously work with a doctor like yourself to get it out of our body and the actual healing process. And it can take time.
Yes.
I just had a hurricane come through where I live, small little water damage. Called my insurance company. Shocker, they're not covering it. Now I have to, kind of play GC and the million things that I have to do with my life here, and go and figure this problem out so it doesn't become, a significant issue. But these are the challenges that people are faced with all the time, right? And I can't just do nothing about it, because the longer I let this problem persist, the more water keeps coming into the house, the more likely I am to have mold growth, right? And so being on top of this now, while it's a smaller problem, it's going to cost me money out of pocket, which sucks. But at the end of the road, I know I'm going to have a healthy home because I'm not letting this problem persist and persist and get worse until I get sick. Right. And so I think that's really helpful for people because, unfortunately, things do happen and we have to stay on top of them.
Yep. We live in a world where bad things happen. We live in a world where floods, hurricanes, or a stupid pipe breaks, or the HVAC system gets a little overheated and drips and then causes issues. But that's what, after we get people better, getting those toxins out, getting them living life again, is trying to give them those tools so that they don't let that leak persist for 6 months next time. They don't let that linger around. If they notice some symptoms, they visit somewhere where they get mold exposure. They deal with it quickly. They don't ignore things or let somebody, oh, you'll be better in a week. No, that water leak is not going to go away. Fix it now before it becomes a $50,000 issue instead of a $500 issue.
Absolutely. And it's always cheaper dealing with it in the front end than on the back end. I mean, once it becomes a big problem, it starts spreading across the house, it's getting into the HVAC system, it becomes a massive project. And
Yes.
then it becomes more difficult to create that healthy environment for you to heal in. So it's really key. Now, I want to shift focus into all the people that know they have mold, that are sick, that are watching this. I imagine they have a very important question for you. How do you diagnose the fact that their house might be making them sick?
Yep. So, first of all, as with any good medical investigation, it starts with a history and physical. So, is sitting down, we spend a couple of hours with our patient on the initial intake, where we're talking to them and going through those things. Did they have a life change? Did they move into a house before they started getting sick? Switch jobs? Did they start visiting a new church? So, looking for those clues in terms of changes in life where they're living, exposures, looking for the symptoms. If somebody comes in and says, oh, I have sinus issues, maybe they're allergic to it, but they're probably not toxic. If they're just, they're sneezing in spring and fall, it's probably not mold toxicity. However, if you're someone where, oh, I've got sinus issues and I've got these rashes that nobody can explain, and for women, their cycles are off, for months on end, or they can't get pregnant. We have a lot of women who mold is preventing them from being able to have babies. They have chronic pain that nobody can explain. All these symptoms that kind of, oh, you got the multi-symptom disease that people can't explain, or an autoimmune disease, thyroid issues. So when we see that person, we're like, okay, you've got some exposure possibility. Yeah, you had a flooded basement 2 years ago. You had a water leak from the laundry last year, and then you had having these symptoms. Then we say, okay, let's look at what are the labs that confirm, because as I said before, some of those symptoms could be actually because you've got mercury toxicity from amalgam fillings. It could be that you've got post-COVID. You had COVID 2 years ago and you've been sick since then, and that's the bigger issue. So we want to look at those other things again to make sure we're not blaming mold for something hypothyroid. Oh, well, take some thyroid medicine and you feel great. But then we look, you're probably familiar with kind of the two big worlds, the Neil Nathan world, Dr. Nathan world of testing using urine mycotoxin testing, and the Shoemaker world using more cytokine markers. There's a lot of debate, both friendly and sometimes unfriendly debate on which is the best way. I will say I use both. In all that I do, I'm trying to use the best of what I see others have found successful and putting it together, getting past the unfriendly debate of things. So we typically will use some of the Shoemaker markers to see if someone's reacting. Then we will confirm things. We will double check Lyme. Lyme and mold can mimic each other. So we'll be checking Lyme tests. But if the Lyme test is normal, nothing else indicates that it's another disease process causing those symptoms, and their urine mycotoxins are elevated, then we're going to start looking. That's when we're going to cross paths with you and the other remediators saying, oh, let's do an ERMI type test. We're doing a PCR, seeing if elevated the molds that are growing in your house or other environment, work environment, wherever it may be, match up with those urine mycotoxins we're seeing. And then we start that kind of investigative process and say, yes, you don't have these things, but you do have reactions to mold toxins with the shoemaker approach, and you have mold toxins present in you and your environment. Yeah, can I say 100% sure? No, but I can say with any medical diagnosis, I can say, yeah, I'm 80 or 90% sure that mold is behind probably 80, 90% of your symptoms. And if we treat that, you are going to see significant improvement if you're getting away from mold, getting it out of your environment by the remediators, and you're doing the therapies that lower the inflammation, pull the toxins out of the body. People generally get better unless they're, again, have another water intrusion event, or they never deal with the mold that was there in the first place. Those are always hard ones because I'm only going to get you partially better if you're still living in mold.
So it sounds like you've got a pretty good process using different testing modalities and really understanding the history of the patient, what they're going through, what their symptoms are, et cetera. Kind of like putting pieces of a puzzle together, right? And
Yes.
your process of elimination, okay, it's not that, it's not that, it's not that. Oh, last thing we got left, it's got to be mold, right? And
Yes.
I love that you have a process, and I love that you help that. I also want to just take the moment to say, with current technological standards, it's just not possible to have one test to be like, boom, this is your problem, right?
Yep.
You can't rule out everything with one test. You can't rule out everything with one question. Where we are with current technology is we kind of have to put this piece of the puzzle together. It's going to require actually seeing a specialist like yourself, going to experts, checking the house properly, because
Yes.
that's it's so
Yes.
easy to check the house improperly. Check the house properly, check the body properly, go through this more rigorous process, unfortunately, because of where we're at with technology. And technology has gotten really great over the past 20 years. I can't wait to see what happens though in the next 20.
But ultimately, it's all a bunch of tools. That's all technology is. And if you had a mechanic going to work on your car and all they did is have one size wrench, you're going like, is that going to fit everything? But we're going to approach that patient with a wrench, a screwdriver, different size wrenches, a few socket wrenches, a few monkey wrenches, a few different tools. So that way, if I walk in, open up your hood of your body, I'm going to be ready for whatever I find there, whether it's mold, Lyme, yeast, post-COVID. You've got to have someone who's able to use the different tools and not just see things, everything as a hammer and a nail, one size fits all.
Yeah, no, well said. Now, what about the people that might be experiencing both mold and Lyme? Do you see that happen?
Pretty frequently.
Okay.
So the issue with mold, and I just wrote a blog post yesterday about how mold can affect the immune system. It was looking at ochratoxin, aflatoxin, and DON, the deoxynivalenol. Whoever knows how to say some of these words, so don't feel bad if you can't pronounce. You're listening to this and you're wondering how to pronounce these toxins. We all argue about which is the right way to say it, but those three toxins have clear proof that they can both either stimulate or suppress the immune system. So in those cases, if you've got someone who had a tick bite 20 years ago, but then they get exposed to mold, that Lyme could have been living dormant in the body, and that immune suppression of ochratoxin, mycophenolic, aflatoxin may cause the body system to weaken so that Lyme wakes up. Or it could be you've had mold, it wasn't causing severe symptoms. You were tired, you had some headaches, but you didn't ever see a mold literate doctor to know that. Then you get a tick bite, and your body is like normally could fight it off, but because the immune system's suppressed, that Lyme goes crazy. So you end up having a huge Lyme attack just because because mold was there in the first place. So when we see that, we're always going to, like I said earlier, we're always going to double check mold and Lyme because there's always a possibility the two, I call them the friends and co-conspirators with mold. If Lyme and mold are there, I'm going to generally look at the mold because mold's probably leaving the door open for Lyme. And I have found that if you deal with mold first, 90% of the time, Lyme's going to be a lot easier to treat because Lyme is usually there because mold is making your immune system too weak to deal with it.
And that was going to be my next question, actually. The process of treating the mold first. You hear that often. That if you know you have mold and Lyme, you have to treat mold first. You have to deal with
Yeah,
mold first. That makes it so much easier to deal with the Lyme. In fact, I've seen people just not even be able to recover from
yep,
Lyme unless
yep,
they deal with the mold. And I wanted to see, that's something that you are seeing in your practice as well.
yep. There is an occasional time if I have somebody comes in who their main symptoms are tons of joint pain, the kind of classical Lyme where this week your shoulder hurts, next week your elbow hurts, next week your ankle hurts, and you just got these migratory arthritis episodes. I will sometimes, again, 1 out of 10, 1 out of 20, I might treat the Lyme first just because that's causing the most intense pain at the moment. But even then, you've got to take care of the mold. You're almost never, I might even say never, going to finish treating Lyme unless you've dealt with mold that's present or other toxins that can go for, say, mercury, and from some environmental toxins that are out there. You have to deal with those before you can truly get rid of the infections.
What are some of the symptoms that both mold and Lyme share that make it a bit confusing to tell the two apart?
Yeah, so that and Bartonella, which is cat scratch, I call mold, Lyme, and Bartonella the kind of the 30-year-old triplets who, when you look at them across the field, they kind of look a lot alike. They share a lot of symptoms, but when you get up close, you go, oh, there's some definite differences. The things they share, the fatigue, um, what patients often get labeled as chronic fatigue syndrome, fibromyalgia, where they're just achy pain. They're just like everything hurts. They can't really put a finger on it, but just everything hurts. People who have a lot of headaches, insomnia, um, mood, they feel like I'm always depressed, or they have panic attacks, anxiety attacks, things like that. Where's the kind of generalized things where they just kind of the yucky stuff that any one of those three could be causing those symptoms before you start looking at the things that differentiate each of those.
All right. And then just segmenting mold apart from a little bit. What are the top, five, if you will, mold symptoms that you typically see in common with patients?
Yeah. So mold, um, it depends between adults and kids. So I'm going to kind of lean a little more towards adults. Kids have a different set of symptoms, more like PANS and PANDAS, the neuropsych things. For adults, it's going to be more, their symptoms typically do this. They'll wax and wane a little bit versus the Lyme patients and Bartonella patients will be like roller coasters. So mold patients kind of smolder. If they're exposed to mold, obviously they'll often have flares of that. But the mold patients typically chronic achy pain. It's not in any one place, just everything hurts. They typically don't sleep well. Their hormones, if they've got female hormones or thyroid hormones, those are a little bit more mold. And then you may have heard about mast cell with the histamine issues. Those tend to be more mold patients where they get reactive to all kind of things, supplements, foods, environmental, chemical triggers. Mast cell activation is a little more mold. It's not exclusive of the other two, but those things stand out as the biggest mold symptoms.
Okay. And you've already seen thousands of people. So I want to ask you something a little bit less normal, which
Yeah,
is tell me about some of the most, tell me about some bizarre cases that you've had that you would have never guessed in a million years was mold, but then turned out to be mold.
yeah. Um, so we have a handful. There's 2 or 3 patients where they were initially diagnosed as having seizures. Went through the neurology workup, neurologist, EEG, CT scans, and ultimately, well, nothing's showing up on your test. Well, you look like you have seizures. Well, let's try some seizure medicine. Uh, Only to come to find out, oh, they actually have mold. And once we got them out of the mold, got the toxins out of them, the only time they're having seizures now, and this is 2 or 3 people, is when they go back to exposure. So they visit somewhere or they had another water leak. So seizures are something that you would think, oh, that's just a standard conventional medical diagnosis. But sometimes that can be an issue. That's probably the biggest one. Um, Mast cell, I will bring up mast cell again, just because it can cause some of the weirdest symptoms. It's not just the, breaking hives, it's not just the sinus allergies, but you can have all kind of weird neurologic symptoms. And it's just because mold made your body so hypersensitive to all these other chemicals. It's those patients that feel like they have to sleep in a tent. They can't go in any store. If they get anywhere near a fragrance or anything like artificial chemical, their life falls apart. And most of the time, as I mentioned before, they get labeled as crazy. This is just all in your head. You've got a conversion disorder. No, they have an hyperactive immune system through their mast cells, all triggered by mold, that if you deal with those things, they get better. Those are probably two of the biggest. I was trying to think. I will say the fun ones, again, I mentioned this also, was the infertility. The women who haven't had children after trying for 3, 4, 5, 10 years, who halfway through mold detox, I get the portal message that says, "Hey, Dr. Potter, I got a positive pregnancy test. Should I change my supplements?" Yeah, we're going to take off some things aren't safe in pregnancy, but it's very exciting to see those women who thought, oh, I just can't have kids. Well, no, you just can't have kids while you still got mold in your body. But once we get mold out of the way, hormones tend to wake up and behave themselves. And then we get to see, happy faces on moms after they thought they couldn't have kids for years. Those are the big ones.
And I've seen that firsthand. I mean, a famous singer, Christina Perri, had a miscarriage in a moldy home. Really wasn't in any good health to have a baby. We got her out, fixed her house, put her in a safe place, and she's now has another healthy, happy baby, which is
Yes.
really exciting to see. And definitely seen cases of people who were dealing with infertility issues, just no matter what they tried to do, couldn't get pregnant, and then realized they were in mold
Yep.
for many, many years, and then got that out, started working with the doctor, and boom, they're able to have healthy, happy babies. And so, it's obviously, it's something that isn't typically associated with mold and isn't talked about enough with mold, unfortunately. And obviously it's something that we need to pay more attention to, clearly. But
Absolutely.
it's wonderful. I mean, seeing that transformation and being able to bring in life into this world is obviously something just extremely beautiful and special. I know that people listening to this right now, they're definitely going to want to know, how do I remove mold from my body? And you already mentioned there's different camps out there. People have different protocols. What are you doing that seems to work best?
Yep. So again, kind of depends on adults versus kids. So I'm going to lean towards talking a little more about the adult side. We will tame things down a little bit for kids to be more gentle. But we kind of, again, not only do we test both Dr. Nathan's approach, Dr. Shoemaker's approach, but I use therapies from both sides. And so I look at doing different binders. Just, you probably heard that term, or if people have listened to your podcast, is something that you take in the mouth, goes into your body, either binds the toxins in the stool, binds toxins in the bloodstream, pulls it out the stool or the urine through the kidneys. You can also do sauna, but that stool and urine are kind of the two biggest exit points. For those patients who have mold toxicity, they don't do a good job of internally chewing things up, which is why, again, 75, 80% of the world can deal with toxins on the inside and don't have to excrete them. But for those who need help, we give things that are binders. So we use the charcoal, we use the clay, we use some different products on that end, whether it's fibers like glucomanins, and then we will advance people up to more either a Welchol or a cholestyramine, using some of the pharmaceuticals, which again gets over to the Shoemaker camp. At the same time, we're also using glutathione that's helping the urinary excretion. So we're increasing the rate that our bodies can get rid of those toxins. So we try to do probably 95% of that through those oral therapies. And then we also use some things, whether it's like sulforaphane or curcumin or milk thistle, things that help the liver just generally detox better, while we're doing all the support therapies of making, if somebody doesn't have good B vitamins, or somebody has a leaky gut, they don't have good nutrition, good minerals, their detox processes are not going to work if you've got a sluggish gallbladder, low in B vitamins. So we're giving those binders. Wherever we find shortcomings, deficiencies, we're filling those gaps in. and enabling the body to get that junk out. Rarely, some patients need some IV therapies where we might recommend IV glutathione that we send out and have someone do for us. But again, probably 95% of the time is really just oral therapies. And then if somebody wants to throw some sauna in there, that definitely helps move things along. But the binder therapy is kind of the core aspect of what we do to get those toxins out of the body.
And that makes great sense. Obviously, binder therapy is pretty much in almost anybody's protocol. And what I think I heard from you that makes what you do so special is it sounds like you are actually testing the individual to see what
Yes.
deficiencies they specifically have that need to be supported in this process. It's almost like you are creating a personalized medicine approach. Is that correct?
Yes. When we start, yes, we have a protocol. This is how we start the process. But I would safely say that 99.9% of patients have several things individualized to them. So, this person, if they're allergic to broccoli, we won't use sulforaphane. If someone is having trouble with, say, the charcoal, we might switch over to a clay only product or switch over to cholestyramine. So, if somebody, again, those other things that travel with mold. Somebody who has mold might have Lyme or yeast, so we may have to treat yeast. So everybody is going to have a personalized, individualized program that is just for them. There's going to be no two people by the end of it that have gone through the exact same process, even if they're in the same family. We're going to be treating because one person may have hormone issues and the other person may have solely gut issues, and we're going to treat them differently.
No, that's awesome. I mean, I love that approach. I mean, I have this theory that personalized medicine is really the future of all medicine as we go through because we're all different, right? No two one of us are exactly the same. We have different genetics, different epigenetics, different environments we're exposed to. And I think all of that plays an important role into this. Uh, I do want to know about the sauna, okay? Because I'll tell you, when I went through my own personal health struggle, the sauna was like, paramount for my recovery. I mean, it was really interesting. I would tell you, like the first 7 days, I didn't sweat at all. Like
Mm-hmm.
I was getting in the sauna and not sweating.
Yep.
All of a sudden, like day 8, I think it was like a switch flipped off in me, and all of a sudden, I started profusely sweating. Like I feel like I should have in 140
Yep.
degrees. But you know, talk to me about the sauna and how impactful it typically is for people. I'm sure there are people that don't do well with it, but for the majority, I would love to hear your thoughts on the sauna and some of the benefits.
So sauna is like any other tool. You want to use it at the right place for the right patient at the right time. We typically will not have patients start out with sauna just because when you're doing the sauna, you're getting good blood flow and you will mobilize some toxins. And I have a lot of patients, if they do that too early, will feel much worse because that blood flow is loosening up toxins that are causing them to have a herx or a detox reaction. So I'll usually get those other oral therapies going first. And then I will see if the patient, you mentioned not sweating. I have a number of patients who mold or Lyme prevents them from sweating, and they may not sweat for 10 years. Those are another fun messages. Dr. Potter, I'm sweating. It's the first time in 20 years. So a lot of them can't. Their bodies have shut down. But when you get that detox going, if somebody says, hey, I'm starting to sweat now, and like, hey, and you've tolerated the binders for a month or two? Yep. Okay. Let's see, start easing into sauna, maybe start with 10 or 15 minutes at a time. Don't cook yourself. I tell them it's not trying to get up to 170 degrees. If you're sweating at 145, that's all you need. You're not trying to kill anything. You're trying to get your body to dump those toxins out. But I do warn them that some people get that detox reaction. I had a number of patients who I'll say, hey, take your glutathione 30 minutes before you hop in the sauna or an extra dose even, and they'll find that, oh, wow, that actually helps. They feel like that speeds up that detox process and keeps them from having that slump at the end of the sauna. Because sauna, as you I'm sure know, most people are going, oh, I feel a little better after the end of that. Whereas these patients who have need that little extra support will like, oh, I feel like I've been hit by a train. So again, it's listening to the patient, starting them at 15 minutes. Oh, all right, let's try 20, 25 minutes. Hey, you're doing great. Let's add, 30 or 40 minutes at 150 degrees. Do it twice a week. build up to 3 or 4 times a week. Make sure you stay hydrated. And there's some who struggle so much, the binder therapy can be constipating. So occasionally I just can't get enough of the therapies by mouth. That sauna adds that extra, what I say, 5 miles an hour, 10 miles an hour of detox. So when we add up that speed together, those patients cross that finish line sooner because they've exited stool, urine, and sweat to get all those toxins out. And sauna will also get some other toxins that the binders sometimes don't always work as well. Some things come out better in the sweat. So if they're doing the sweat too, you're clearing out not just the mold toxins, but a few heavy metals and a few other synthetic toxins too.
Yeah, no, well said. And I was taking some niacin and B vitamins, and certainly was drinking tons of
Yep.
electrolytes because, of
Yep.
course, depleting salt and potassium happens pretty naturally. So I think it's, doing that with doctor's orders makes good sense.
Yes.
What are some of the biohacking things that have come out in the last few years that you also find helpful that people might want to look into?
Yeah. So the simple things, just starting with always looking for what I call the friends of mold, the Lyme, the Bartonella, the yeast, EBV, that causes mono, Epstein-Barr, looking for those things that travel with mold. And then patients will often ask me about the things like hyperbaric. They'll ask me about ozone therapy. They'll ask me about infrared. Again, all of those things have roles in someone's recovery. Um, the hyperbaric, ozone therapy are typically things I will put more at the end. They're a little more helpful with the regenerative phase. The detox phase keeps you busy enough with taking binders and doing sauna. And then as patients or those levels are going down, they're 60%, 70% better, but they need a few things. Hyperbaric can sometimes flip that switch over. Infrared therapy, kind of combined with sauna, can do some of the red light therapy, can enter some of the fatigue that's left over. Oh, that tips them over the edge. So we're using a lot of those biohacking type things in the end. Occasionally, patients will do some NAD therapy. Typically, most patients don't need that by the time that their bodies are kicking in pretty well by the time we detox them and replenish the other Bs. But those are some of the things we'll add in there at the end. The last thing I would say, I think I've heard you talk about this in a podcast, limbic therapy, DNRS kind of things. A lot of patients, the limbic system, the inner part of your brain that deals with emotions, PTSD kind of things. A lot of patients get stuck, just like if you've been in a bad car wreck, been mugged. Your body gets into these anxiety fear loops. Mold, Lyme, Bartonella can all do that as well. So sometimes patients will have all those toxins out, but they still have their fear alarm bells going off. You want to get out of mold. This is not the way, you will have some people out there, oh, if you just turn down your limbic system, turn off the alarm. Well, you can turn off the fire alarm, but if there's a fire in the building, you're still going to be harmed by it. This is where you've dealt with the fire, you've dealt with the toxins, but your alarm bells are stuck. So you go back in there and kind of help reset the alarm bell thermostat using some limbic therapy. There's different ways to do that. We use a program called Safe and Sound. We have a limbic coach in our clinic that walks people through that. So that one is probably the biggest, most used thing we use for patients beyond get away from the mold, get the mold out of you, turn off inflammation, and then turn off these fear responses, the PTSD limbic system aspect, using some form of limbic therapy is the biggest biohack at the end.
Oh, that's awesome. I love how you're kind of attacking this at all possible angles, which is really nice, to see all these things come together. I think that's really important. And obviously, not every person might need limbic, retraining, but to be able to offer that for those that do need those benefits, I
Yes.
think that's really cool. What are like the top 3 roadblocks to recovery that you find people stumble into that's hard to overcome?
Yeah, the number 1, 2, and 3 are all getting the clean house. If you want to, I'll cheat that way, but I will give you 2 more anyway. But that really is the big number 1 is the patients who come back. I'm still sick a year later. I'm like, well, did you deal with that high level aspergillus in your house a year? Well, we wiped it up and we sprayed some bleach on it. I'm like, okay, let's take a step back. You still got some aflatoxin, ochratoxin in your body because you never dealt with that. Or, oh, well, yeah, we cleaned up our house, but we didn't clean up the beach house. Okay, and we just spent there for 3 months. We went, we were there for over Christmas. So I'm like, okay, number one is always going to be, if you're still living and breathing mold, you're not going to get as better as you would hope. Number two is going to be those other infections, whether it's the yeast that you never dealt with, the Lyme infection you never dealt with, the Epstein-Barr. Those are the things that are going to be an issue. And then number three is probably going to be that limbic system again, where I have patients who all their labs are good, their urine mold tests are better, but mold has so traumatized and broken them, say over 5, 10, or 20 years, and maybe multiple family members, especially if it's a parent with several kids who have gone through mold. That limbic system can be the thing that keeps them stuck in that. And if you get over that hump, all of a sudden they start living life again. So really, again, getting out of mold, getting rid of those things that travel the mold-like infections, and getting the limbic system being able to overcome the leftover trauma. Because again, I've lived through this. I hate mold. When I see pictures that my patients, probably some pictures similar to what you see when you look in some HVAC ducts or look under houses and like, oh my, mold hanging down from rafters, mold growing out in puffballs in the HVAC system. I'm like, okay, deep breath. I'm remembering what our house was like. It's traumatizing. And thinking about, I can still picture my less than 1-year-old daughter in hives from the moldy house. It's when you see your children like that, it's scary. So that limbic system, you have to turn down those responses. Now, I tell people, don't turn off your radar. If you go into a building, smell mold, or get that weird sense, yeah, I'm starting to get a headache, I think there's mold here. Yeah, you need to go out the door. You don't need to stay in there for another hour and a half. But you don't need to be panicked and scared of it. You just need to know, okay, yep, there's mold here. Let's turn around and go back. Let's make some changes, but don't let it ruin your life because you're looking for mold around every corner.
So, in talking to the audience for a second, if you heard Dr. Potter, I'm going to repeat what he said. If he could give 1, 2, and 3, get out of the fire, fix your place up, and get into a healthy environment, he would, right? That's one of the biggest roadblocks to
Yes.
this. And so, if you need resources, finding an inspector, I have resources for you. We'll put them in the show notes. Getting a proper inspection is really important, because if you don't know where the fire is, how are you going to make sure you put it out? Right. And so it starts with getting a proper inspection, not just a guy coming in and taking one air sample in the center of your house and telling you everything's fine. You need a real proper inspection to figure out, where is this fire coming from? Because otherwise, you're going to open up the wrong walls, you're going to remediate the wrong things, and you're still going to be inhaling that smoke. So it's really important. It starts with a proper inspection. Then, of course, it finishes with proper remediation and really scientifically improving the quality of air that you're breathing. Everything should be data driven. Just like when you go to a doctor, you're performing that analysis, you're getting test work done. Those tests are data driven. It's the data that from everything that encompasses your first visit that helps doctors prepare a program for you, right? And so everything needs to be data driven. Your house should be treated just like you would treat your body. And so I think it's really, really important. Dr. Potter, before we go, I want people to be able to connect with you. Where can everyone find you? How do they get into your clinic to get the healing process started? Please tell us.
Yes. So we're located in Franklin, Tennessee. We do take care of patients across Tennessee and surrounding states. Our website, Sanctuary Functional Medicine. We've been here over 10 years. We have an office space here. We always want to see patients in person for the first visit, because we need to, again, make sure that we are taking care of everything that's going on. But on the website, There, you can fill out forms. We have 3 team members who are returning those calls, and we'll talk to you. That initial call with them, you spend an hour. We want to make sure that we're able to help you. So they're going to ask you a lot of questions, get those information, and also answer your questions. So once we know, yep, this is a good fit, we will get you plugged in. I have 4 other providers with me, 2 nurse practitioners, 2 physician assistants. They basically serve as my hands and feet. They are going to see you. I come in, I spend time with you as well. And we're going to be looking again across the whole person. And then we bring in a health coach, we bring in a nutritionist, a dietitian, and then if needed, the limbic therapy that we talked about. So we have a whole team who is supporting our patients through that here in Franklin. But again, we are willing to help those across the area, across the United States, if you're willing to travel to see us. And are trying to do our best to help people, and then are thankful for Michael here and all those remediators out there who, again, as he said, do things the right way. We've had a number of those where, no, that bleach, that drying things out isn't going to be enough. We're going to have to go back in there and remove that mold. So we're thankful for Michael and others who do things the right way, and we are glad to help those on our end of what we can do.
Absolutely. Dr. Potter, thank you so much for all that you do and helping all those people and continue to help all those people. Really appreciate you and the work that you do. Until next time.
Yes. Enjoyed it. Thank you.